Hey folks, welcome back. Shriners Children's Portland improves the lives of children by providing specialized pediatric orthopedic care, conducting innovative research, and offering outstanding education programs for medical professionals. Children with orthopedic conditions and cleft lip and palate are eligible for care regardless of the family's ability to pay and receive all care and services in a compassionate, family-centered environment. So here to chat more, thanks to our sponsors at Shriners Children's Hospital Portland, is pediatric surgeon Dr. Garrett Zallen and patient Cruz Pineda. Welcome to the show, y'all.
Well, thank you. Thank you.
Oh my gosh, it is great to have y'all here today. Now, Dr. Zallen, I got a question for you. You specialize in providing care for children with chest wall deformities. What are these conditions?
Yeah, so there's really three main ones that we see. One is when the sternum sinks in and gets compressed in. That's the most common that we see. The second is where the sternum gets pushed out. That's kind of the second most common that we see. And then there's a third that people don't really know too much about because it's kind of hard to see in people. That's called Poland syndrome. Poland syndrome is where you're missing part of the chest wall. So when you're born, you're actually born with not as much tissue on your chest wall as you're supposed to have. And as you grow and develop, it can start to cause problems in terms of development of the chest wall and the muscles. So those are the three main ones that we see. The first one, where the sternum goes in, is called a pectus excavatum. Where the sternum sticks out, it's called a pectus carinatum. And then finally the Poland syndrome. So those are the main ones.
Well, when should a concerned parent have their child evaluated if they think they might have a chest cavity issue?
Yeah, well, being a parent, and so I would say anytime a parent is concerned about something, they should get it checked out. We see kids who are anywhere from infants all the way up to teenagers. I even treat adults as well. So there's a lot of misconceptions that go along with these conditions and a lot of sort of misinformation that's out there. So I think anytime a parent has a question when they're looking at their kid's chest wall, it looks different, something's not quite right, they can talk to their pediatrician about it. If their pediatrician doesn't really have any information for them or is not sure what it is, we're always happy to see them. We may not do anything for a number of years, but just getting information to the families and to the parents can be really reassuring because most of these are conditions that can sort of be treated in the future or may not need any treatment. So there's options. I think that's the most important thing to know what those are.
Absolutely. And Cruz, you had an experience kind of similar to what Dr. Zallen is talking about. Tell me about your experience with Shriners Children's Portland.
Yeah, so I was diagnosed with pectus excavatum, and we realized that I would need surgery, and my dad has worked with Dr. Zallen before, so he knew right away that he was the guy to do it. You know, a few months later, we got the surgery, successful surgery. Yeah, I'm super thankful for everyone that was involved because it was a great experience, and yeah.
And how has your life changed since that surgery? How has it improved your quality?
I mean, just personally, I think it looks a little better. It also, I can take deeper breaths, and I play sports. I do football and track and field. I've done, this past year has been my best year by far in those sports, and so yeah, my quality of life, I guess, has improved. So yeah.
Rock on, dude. That is amazing to hear. And tell me about your experience in general. Was going to Shriners Children's Hospital just kind of a weight off your back?
Yeah, it kind of was, because we knew that, you know, we were going to have to do something about it at some point. So while I was kind of upset at first, because I was thinking it was going to be a setback in my athletic career or academically, I wouldn't have it any other way. I'm glad we did it.
Absolutely. And Dr. Zallen, tell me about working with kids with chest issues throughout your career. What is something that you commonly see?
Well, I think Cruz's story is a wonderful story, but it's a very common story. I see a lot of these kids who come in who are struggling either athletically or just from a body image standpoint, the way that their chests look, and they don't know that there's options, they don't know that there's things that we can do to help them. And then we're able to either get their chest fixed with a brace if it's a pectus carinatum or if it's a pectus excavatum like Cruz had. We can do a surgery that fixes this. And it makes their life better. This is the one surgery that I do where families have told me over and over again, you've changed my child's life.
Oh my gosh, that is amazing.
And it does. And it is such a big difference for these kids and the parents to be able to see their kid really flourish and not have to deal with the issue that these can cause.
Yeah, absolutely. It's just providing that care and being able to change the lives of some folks and kids, especially in the Portland area. Well, Dr. Zallen, Cruz, it is great to have the both of you here on the couch, and thank you for sharing both of your stories. It is amazing.